The kind of thing we've done instinctively in our workplaces for 2 decades, sending a quick email instead of setting up a meeting, has until recently eluded many doctors. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Electronic consultations, or e-consults, sometimes called e-referrals, are a growing way for primary care doctors and specialists to communicate with each other securely. They can help patients avoid additional visits to specialists and free up capacity in crowded health systems, reducing waiting time for others. Studies have found that a large proportion of referrals to specialists, upward of 40% in some cases, are not needed. Getting the right medical advice without another visit to a specialist might be especially helpful for patients on Medicaid or without insurance. One national study found that nearly 1/3 of specialists are unwilling to make appointments with new Medicaid patients. Delays in getting the right advice from a specialist can cause harm. For patients who would have to travel far to see specialists, those in rural areas, for example, e-consults can save considerable time, expense, and headaches. Here's how e-consults work. When a question arises that your primary care doctor can't answer without advice from a specialist, whether an MRI for knee pain is warranted, for example, or how to interpret a test result, she messages a specialist reviewer for help. That reviewer engages in an electronic dialogue with your doctor to gather information and decide if the issue can be addressed without a separate visit. Often it can be. Some of the early e-consult adopters were the larger public health systems in the United States, including the Veterans Health Administration. The first U.S. system to adopt one in 2005 was the San Francisco Department of Public Health. Wait times fell, and a large majority of primary care doctors said it improved care. The Los Angeles County Department of Health Services, the second largest public health care system in the nation, began using e-consults in 2012. A study in Health Affairs tracked waiting times for 12 types of specialists, including cardiology, gastroenterology, gynecology, ophthalmology, podiatry, and urology. And before the e-consult system, waiting times for some specialists extended months. For gastroenterology and urology, 1/4 of patients waited over 9 months for an appointment. By 2015, 3 years after the LA County e-consult system was in place, waiting times for specialists had fallen by an average of 17%. To 52 days from 63 days. The proportion of appointments scheduled within 30 days rose to 30% from 24%. 1/4 of e-consult engagements between primary care and specialist physicians were resolved with no visit at all. Perhaps for this reason, a vast majority of primary care doctors express high levels of satisfaction with e-consults, according to a systematic review of them published in 2015. Patients generally report good experiences and high satisfaction with e-consults too, though one study found that patients were equally satisfied with them versus in-person appointments. Most studies report high satisfaction from specialists, but one found that a large minority, 26% of them, were dissatisfied. The concerns expressed included unclear clinical questions and the possible liability associated with providing medical advice for patients they hadn't examined. In one study of the Mayo Clinic, a majority of primary care physicians said e-consults improved the quality of care. However, another study of the LA County system showed that primary care doctors said e-consults shifted work and administrative burden to them. Despite such limitations, e-consults have also performed well in other health systems. Randomized trials in a Veterans Health Administration hospital and in a community health center found that e-consults significantly sped up specialist input. A systematic review of e-consult systems in the United States, including at Kaiser Permanente and the Mayo Clinic, and abroad, yielded similar results, but little evidence on improved outcomes. Electronic consultations are less expensive than in-person visits, but they aren't without cost. Someone has to do the work of figuring out how to respond to each inquiry. Some insurers and public programs, Medicare just started covering it this year, reimburse physicians for e-consults, but patients don't pay for e-consults, whereas in-person visits would typically cost them something depending on insurance coverage. That sounds like a great deal. But to the extent e-consults increase the volume of patients seen by the system, as has been found in some studies, that could contribute to rising healthcare spending. That may be money well spent if they contribute to better health, something that has not yet been documented. Hey, if you like this episode, click wherever it is on screen that you see a link that'll take you to a great episode on telemedicine, which is another way to get care without going to the office. And also don't forget to support us on patreon.com/healthcaretriage. We'd especially like to thank our Surgeon Admiral Sam and our research associate Joe Sevitz.